Well, the month of May is Celiac Disease Awareness Month. So what exactly is celiac disease and how is it treated? Here to sort it all out is Dr. Jeffrey Gelwan. He is the gastroenterologist at Hartford HealthCare's Digestive Health Center. Thank you so much for being with us, doctor.
And thank you for inviting me.
Yeah, my sister-in-law was diagnosed with celiac disease in her 30s, and before that, she just thought it was normal to always have a stomach ache. So what exactly is celiac disease and how common is it?
So that's a great question. So celiac disease is a chronic inflammatory disease of the small intestine, and it's triggered off by an abnormal immune response to the dietary protein gluten. It's present in approximately 1% of the population, and it is increased in patients that have a family history, patients who are diabetic, patients who have other autoimmune diseases that might be present. So it is fairly common.
Yeah, I mean, and we're hearing, a lot of people are trying to be gluten-free, but there's a difference between actually having celiac disease. What symptoms should people be looking out for if they're concerned that they may have this?
So one of the problems that we're seeing is that the typical celiac symptoms only represent about 27% of the patients that present to their doctor's office. And those symptoms include diarrhea, bloating, and weight loss. 52% of people actually have non-classical symptoms. Those symptoms will include things like iron deficiency anemia, osteoporosis, neuropathies, ataxia, which is a loss of balance, and even thyroid disease itself. And about 25% of people are totally asymptomatic. Because people present so atypically to their doctor, most doctors are not aware that they do indeed have celiac disease, which is a dilemma for us and a dilemma for the patients as well.
Can you get tested?
It can. You see, the problem that we have is that we've noticed there's about an 8-year delay in diagnosis, at least in the early 80s. Now it's down to about 4 years. So people have to suspect that celiac disease is present to be able to test it. So, it's interesting. For the most part, most of the diagnoses are made by gastroenterologists, probably 75% of the time, but most of those patients have seen primary care doctors, GYN for infertility, have seen endocrinologists for osteoporosis, various other specialties who have not thought of celiac disease as an entity. You can test them with blood tests, with endoscopies, with actually their response to a gluten-free diet as well.
Doctor, in less than 30 seconds, because we're running out of time, but what treatments are available?
So the first thing is usually to consult with a dietitian, because it's a lifelong adherence to a gluten-free diet. It's also education, but it's also continuous follow-up with a multidisciplinary team like the one we have at Hartford Hospital. We've developed a huge team of 16 gastroenterologists along 16 service centers that provide care, including 2 GI pathologists and 2 nutritionists that help us along the way.
Thank you, doctor. And we know there's so many questions out there, but we want to let people know that they can learn more, maybe even make an appointment with you or someone on your staff, but you can visit hartfordhealthcare.org/digestive.